Today, surgery can deal with almost any disease, but there's one that continues to frustrate it. Cancer, the ultimate disease. Humans have fought this silent nemesis for over 4,000 years, but to this day, we're still unable to claim victory against it. In China, the survival rate for cancer patients 5 years after surgery is only 36%. About 2.3 million people die of the disease every year, and about 3.8 million are diagnosed with it annually. This means that, on average, 7 people are diagnosed with cancer every minute. But humans are not the only victims of cancer. The American Museum of Natural History in New York City is the largest of its kind. The museum is home to the world's finest paleontological and anthropological collections. This is the first complete fossil of the Tyrannosaurus ever excavated. Paleontologists believe that this giant reptile that existed 66 million years ago could be the earliest known victim of cancer.
The largest tumor on this mounted specimen is right up here, right at the base of the neck. It's large, and it would have probably been pretty painful when the animal was alive. On the skull of this one, on the other side of the face, that there's a big rough area, and that big rough area has been interpreted as either a tumor or an abscess. A lot of different Tyrannosaurus rex specimens and other tyrannosaurs, like some of the Asian tyrannosaurs like Tarbosaurus, Alioramus, also show these kinds of diseases that when the animal was alive.
Cancer isn't a single disease, but a general term for a class of diseases. Its most common symptom is malignant tumors growing in organs, muscles, blood, and other parts of the body. Unlike normal benign tumors, malignant tumors grow uncontrollably, and they recklessly snatch nutrients from the human body. They can even spread or be transferred, eventually leading to the death of its host.
Cancer is a terrible disease, and you can think of it as a crab with claws grabbing you and not letting go. And so that's why the old Greek crab is a good word for cancer.
它无序的生长，这个没有人管得了它，它非常自由的发展，长得非常快，成倍的增长。在无序的生长过程当中，它要吸收营养，所以晚期肿瘤的病人很多是消瘦。
Even 4,000 years ago, doctors sensed the existence of what we now know to be cancer. Imhotep was a doctor in ancient Egypt. He left behind a detailed account of cancer on papyrus records. In it, there's only one line regarding treatment. There is no cure. When modern surgery came along, people tried to use the scalpel to defeat cancer.
还是画的是什么？你画了2个什么？就是贝里奥的那个。哦，贝尔里面的怪兽啊。哦，是真正的王子啊？那谁是假的王子呢？爸爸是假王子啊！你爸爸要哭了。
Li Yuyun is constantly trying to hide her anxiety from her 5-year-old daughter. Just 15 days ago, doctors discovered a lump in her right chest, which was then diagnosed as breast cancer.
做了钼靶、B 超，还有核磁共振，还有 CT。那个时候这个等待真是很忐忑的。护士然后说不太好，你自己进来看吧。这时候我整个身体的感觉是软软的，幸亏我女儿在旁边。
She took the suggestion of the doctor and opted for surgery.
因为这是要开刀了，也不知道开出来结果怎么样，也没有在女儿面前流泪，因为她表现出很坚强，跟我说：“妈妈，你走，你要听医生的话，我打针不哭，你也不要哭。”
穿刺的病理报告。
为右乳穿刺为今日起癌。
好的，好 ，OK， 那我们开始。
Doctors extract some tissue from Lee Yu-Yuan's mammary gland for a biopsy.
前侧淋巴结液。
From the tissue, doctors determine that Lee Yu-Yuan's breast cancer is at the middle to advanced stage. To prevent the cancer cells from spreading, gland, fat, and fibrous tissue, and even part of the lymph in Lee Yu-Yuan's right breast, are excised, leaving only the skin intact. Doctors then implant a breast prosthesis so that Lee Yu-Yuan's body will look more or less the same as it did before.
我们的追求是什么呢？给病人最小的伤害，然后呢，给病人带来最好的治疗的效果。这个是完全的改变。
Today, the average 5-year survival rate after breast cancer surgeries is 83.2%.
其实你应该这么想，在这么多癌症当中，你得乳腺癌应该说是你很 lucky， 你很幸运，它是可以治愈的。
Breast cancer resides on the surface of the human body and was the very first in history to be treated with surgery. It was here that one pioneering doctor tried to change the belief that this disease was incurable. The Johns Hopkins University School of Medicine in Baltimore, Maryland, is the most prestigious medical school in the United States. When modern surgery emerged at the end of the 19th century, a renowned doctor from New York named William Halsted came to work here. Thus began his lifelong battle against breast cancer.
This is a statue of William Stewart Halsted that was created after his death. But it's meant to celebrate his life. And you can see his glasses, and he was famous for looking over the top of his glasses when he didn't like what someone said.
Back then, the most common treatment for breast tumors was to remove the entire breast. But Dr. Halsted noticed that the rate of relapse after surgery was high, and it often occurred near where the last incision was made.
Halsted carefully studied the anatomy of the breast, carefully studied how the lymph nodes drain, and developed the radical mastectomy. This fundamentally changed breast cancer.
After continued research, Dr. Halstead believed that breast cancer was a primary disease of the breast that invaded surrounding areas radially. The high relapse rate after surgery was due to incomplete excision of the breast. As a result, when operating on breast cancer, Dr. Halstead would excise parts of the muscles, lymph nodes, and even the collarbone in addition to the tumor. He would then transplant some skin from the thigh to close up the incision.
So one of the reasons that the radical mastectomy is important for historical purposes is that Halstead gave thought to the operation in terms of how to treat a cancer. So he gave thoughts in removing the entire tumor and the surrounding normal tissue to make sure that there were clear margins to get out all of the residual tumor, and also to remove the lymph node drainage bed. And that's really why this operation was a landmark operation.
Inspired by Halstead's work, radical surgery became the main method for treating cancer. However, although this improved the survival rate after surgery, the extensive cutting did great damage to the patient's body. Sometimes, even at this great cost, the effort was in vain. Back then, Dr. Halstead didn't really have a grasp of the real pathological mechanism of cancer. It was not until 30 years after his death that the secret was finally revealed through the observation of cells. Cells are the basic unit of structure and function for any organism. As long as there's life, cells will keep dividing to help the organism grow and heal. And that's also how cancer works. Under the microscope, we're able to see the division of healer cells, which are probably the best known cell line in the world. A total of 18,000 generations of these cells have been reproduced in the lab. In 1951, the cells were first extracted from Henrietta Lacks, an American woman suffering from cervical cancer. This was also the first time humans had successfully extracted cancer cells and cultured them in vitro. Normally, cells will die after about 60 rounds of division. However, when triggered by certain factors, cells can suddenly ignore the normal rules. Just like healer cells, they can keep dividing uncontrollably, resulting in cancer. Furthermore, when a malignant tumor can no longer contain the sheer amount of cancer cells, those at the edge of the tumor will spread through the flow of blood and lymph or other paths to other tissues and organs.
Cancer is an abnormality in cells, so that they do not behave and act in the normal way. And these abnormal cells can grow, and the word for a growing cancer is a malignancy.
Because there's so many cancer cells. There are probably over 1 billion cancer cells in every cubic centimeter of a cancer. So you can imagine a patient that has 3 or 4 nodules in their liver. They have billions and billions and billions of cancer cells in their body. We may be able to kill 99% of them, but still many millions will live after that. So the large number of cells that are present in advanced cancers makes them very difficult to treat.
The discovery that cancer was not an entirely local disease effectively stated that surgery could not cure all cancers. But instead of giving up, the medical world resumed their attempts with new approaches. This is the Zhongshan Ophthalmic Center of Sun Yat-sen University in Guangzhou. Before even having the chance to celebrate her first birthday, Liu Shumeng was diagnosed with retinoblastoma. Retinoblastoma is a malignant tumor that occurs in 1 out of every 15,000 infants and young children. Without timely treatment, the disease could lead to visual impairment or even death. An effective way of treating the disease is to get rid of the tumor bit by bit using liquid nitrogen at a temperature of -80 degrees Celsius. A probe is extended into the fundus. It touches the tumor, freezing and unfreezing it repeatedly, and eventually kills it. However, this procedure only works on tumors with a diameter of less than 3.5 millimeters. The tumor in Shumeng's eye is 11 millimeters in diameter. To make surgery possible, doctors have to first treat Shumeng with chemotherapy to shrink the tumor as soon as possible. Chemotherapy is common in cancer treatment, but refining this method was a long and winding process. Back in the 1930s, most surgeons were trying to use radical surgery to treat cancer. But some researchers were looking for a medication that could be applied to cancer cells. During the Second World War, a poisonous chemical known as mustard gas was often used in the battlefield. Although it was a fearsome weapon, it also caught the attention of medical researchers.
The use of it by the Germans and by the English and finally the Americans was really a disaster for soldiers in the front line. However, it was noticed at autopsy of these soldiers that their lymph glands were markedly shrunken, that the glands that make the lymphocytes, that are the cells that make the immune response work, were destroyed.
After entering the human body, the gas did not greatly affect other parts, but it did kill large quantities of white blood cells, the cells in the human body which divide the fastest. As a result, some believed it could also be used to kill cancer cells which divide just as rapidly.
The idea that there may be drugs out there that could selectively kill cancer without killing the host of the cancer really is born from the use of nitrogen mustard. There's no question about that. And a lot of effort started to go into screening of agents, both natural agents and agents that might be found in the lists of pharmaceutical companies, to see if something might work.
Using that idea, scientists started to develop a myriad of anti-cancer chemical drugs. The procedure became known as chemotherapy, and it has gradually become one of the standard methods for treating cancer. Due to their high sensitivity to chemotherapy, retinoblastoma patients today have a survival rate of over 90% after undergoing chemotherapy and cryosurgery.
不管怎么样，这个小孩子在治疗过程当中可能要承受很多的痛苦。我们希望吧，他的这个药能够治好我们的宝宝。
Little Shumeng will soon be ready for surgery and regain her health. However, unfortunately, not all stories have a happy ending like this one, and this is because chemotherapy can result in considerable physical damage. For most patients with advanced cancers, the combination of chemotherapy, radiotherapy and surgery only offers a 10% chance of survival.
Chemotherapeutic drugs are generally selective, which is to say they prefer to target and kill cancer cells, but inevitably, inescapably, they will also inflict some damage on normal cells. And so they must be used in very carefully measured doses.
实际上也部分的癌，有些癌可以治愈，化疗可以治愈，但是大多数可能癌肿瘤可以就是暂时控制，彻底治愈，这个不是多数，是少数。
If aging and death are inevitable, what options are left for doctors? The deadly nature of cancer brings out another side of medicine. At the Department of Geriatric Medicine of Peking Union Medical College Hospital, a special group consultation is in session. The doctors are not discussing how they're going to cure 61-year-old Luo Hong, who has advanced cancer, but how they can alleviate her pain and let her spend her final days at home.
还是有回家想法，但是他这个病变真的是反复复发，不断的恶化，他自己都说哇没有准备好或者怎么样，他自己比较担心，是不是能够从专业角度能怎么帮他的地方，这个确实需要一个专业的引导或者疏导的一个过程。
我这半年反正全家和和睦睦的，然后我也愉愉快快走过这后半年，我就知足了，这啥遗憾也没有。 今天比明天，你说我能当回事吗？今天这个烧，明天那个烧，我就没法休息。
4 years ago, right after her retirement, Luo Hong was diagnosed with malignant soft tissue fibromatosis. To kill the tumour, she went through 4 surgeries and over 30 sessions of radiotherapy. But less than 6 months later, she had a relapse, and this time, the cancer was more aggressive.
她的疾病又再次发起来了，复发了或者转移了，然后并且威胁了他们的生命。所以我的印象最深刻的是，恶性肿瘤、癌症是一个时常可以威胁人生命的这么一个情况。这个是让医生、让所有的病人和家属非常沮丧的事情。
Complications and unbearable pain left Luo Hong confined to bed. She felt helpless and fragile.
那个大腿根疼得不行，疼得不得了，明白？刷牙都做不起来，吃饭也做不起 那就是不是活不了多长时间？比如我问的一个问题是，你觉得活不了多长时间？多长时间就是活不了，就算时间挺短的？
半年。
半年啊。我第二个问题是，你为什么突然想到了问这个问题？
特别怕我早早的走，没人照顾他。
你是这么想的吗？
想，他说
他摇头了，他摇头了。
他一说，我半夜就老惊喜。
是，我觉得他的反应挺正常。
To help patients leave this world in a peaceful and dignified way, doctors will try their best to aid them and their families, providing them with pain relief treatment and helping them better deal with anxiety and sadness. For doctors in oncology and geriatric medicine, this can be a daily part of the job.
那挺好，那挺好。
我们讲终极关怀，就是我们对人到底应该从本源上关怀他什么呢？实际是4个字儿：生与死，苦与痛。这好像不是医生说的话，这好像是宗教说的话。其实医生也是一样，这样做并不意味着我医学不发展，并不意味着我医生不努力。我要尽力去做，因为我是医生。
Death is inevitable for all of us, but delaying it as much as possible and enjoying one's last days is still what most people pray for.
If there isn't a real clear-cut goal to get the patient well, then the doc, it seems to me, has to help the patient out and get him or her to a better place. So I think it's all about determination, both to help the patient to get well and to help the patient out of the world when there isn't any more hope.
Around the world every year, over 9 million people die of cancer. The most important reason for this large figure is the unpredictability and diversity of malignant tumours. Even tumours of the same type and at the same stage can have completely different responses to the same treatment. For years, scientists have sought to discover why cancer has this terrifying nature. With the development of genetics, American scientists found the answer. Today, technology allows us to look inside the tiny world of cells. Within the nucleus are 2 closely intertwined threads. They are deoxyribonucleic acid, or DNA. They cling to each other like a rising spiral ladder with genes on every segment.
Ancient concept, it was firmed up in sort of the 1800s as a unit. It didn't have to be a unit, but it is a unit that encodes some functionality that does a specific task or set of tasks. Almost everything about your body is encoded by a gene, and these are inherited from generation to generation, and variations in the genes determine how you're different from your siblings and other people on the planet.
Genes determine the colour of our hair, skin and eyes, and also whether we're right-handed or left-handed. They can even decide if we are optimists or pessimists. In 1978, Michael Bishop and Harold Varmus, two professors at the University of California, San Francisco, discovered a special gene called proto-oncogene through their study of chickens. This gene is a normal part of the cell, but it can mutate and divide endlessly once affected by external factors, eventually leading to cancer. It exists not only in chickens, but in the cells of all living organisms, including human beings.
Every cancer arises from the malfunction of genes. I don't think there's any, that we're all that special in terms of getting cancer, and if we are, I would rather we weren't.
Since then, scientists have discovered over 200 kinds of proto-oncogenes in the human body. Their mutations and the combinations of different mutated genes have created cancers so diverse that sometimes even doctors feel helpless.
20 years ago, if you ask a surgeon how many kinds of breast cancer are there, he would have told you 3. Now, when we look at the genetic composition of breast cancers, we know there are many more subdivisions, types, which goes a long way to explaining why one form of therapy doesn't work for all breast cancer, or any other kind of cancer for that matter. It indicates that we have a rough road ahead of us. We're going to have to deal with extraordinary diversity among cancers.
In a bid to contain the disease's seemingly infinite means of assault, scientists started to seek a breakthrough from a genetic standpoint. Fudan University's key laboratory of metabolism and molecular medicine is one of the China Ministry of Education's key labs. Researchers here are injecting a proto-oncogene found in a human into a fertilized egg of a zebrafish. Soon they will induce mutation of this proto-oncogene to generate cancer cells in the zebrafish larva. Because the zebrafish develops so rapidly, researchers can observe the generation mechanism of cancer cells in a brief period of time. By trying out different drugs on the zebrafish, they can quickly find which ones will have an effect on the mutated proto-oncogene. These are known as targeted drugs.
如果把一个肿瘤比作是一辆车的话，那这个靶点就是司机，而其他的这些测到的基因突变都是乘客。我们首先要明确这个司机的靶点，这个驱动的基因是不是在这个瘤肿当中起着关键的作用，然后再给予靶向治疗，能够起到更加好的疗效。
它都是表面上、表观上看起来都是肿瘤，但是肿瘤的导致的根本原因是哪些基因出问题了，它不是一样的。同样一个肺癌，它有好多不同的诱因，那么你在治疗上面，你就应该有针对性的去进行。
Targeted drugs can control cancer cells more precisely, thus reducing the damage they cause to healthy cells. They all work in different ways. Some prevent proliferation of cancer cells, some poison them to death, some motivate immune cells to destroy cancer cells, and some cut off the nutrition supply by preventing blood from flowing to cancer cells. But targeted drugs only work on patients who possess the precise targets. They may, to a certain extent, repress the development of cancer. But the best they can do is delay the arrival of death.
These people were incurable before, and they died quickly, even with chemotherapy. And when they first got this inhibitor of the JM accelerator, many of them got out of their deathbeds and walked away and missed me. Now, was it a true cure? No, because eventually most of them develop drug resistant. So you have to make a new drug.
Some researchers found an alternative solution to that problem. They went directly to the human body, modifying the immune system to try and cure cancer once and for all. 8-year-old Emily Whitehead is from Phillipsburg, Pennsylvania. Emily is energetic and curious like all girls her age. It's hard to believe that this young child was once fighting for her life against acute lymphoblastic leukemia.
I took her to the pediatrician the next morning and ran down the list of symptoms of what we were experiencing, and I could tell by the look on the pediatrician's face that she knew it was something serious. And we got some blood work done, and within a couple of hours the pediatrician had come back in and sat down and just said, "It looks like leukemia."
While most young children with acute lymphoblastic leukemia are responsive to chemotherapy, Emily was not that lucky. After 16 months of chemotherapy, the family was told of a relapse.
And our hospital there told us that they had run out of weapons to fight our cancer, and that there wasn't anything else that they could do. And so they said that we could take her home and we would have a few weeks with her, or possibly a few months.
In their time of despair, they found out by chance that the Children's Hospital of Philadelphia was working with the National Cancer Institute on a new clinical experiment on blood tumors. While the results were far from clear, Emily's parents believed this was their daughter's last chance.
Where's the power of this? Yeah. Is it on? You got the wrong person to do this.
Our team is working on developing ways to educate the immune system to make them able to kill cancer cells.
Human beings are equipped with a very powerful immune system. The T cells in our blood protect us by hunting down and killing problematic cells once they detect something ill-natured in them. However, some cancer cells seem to know how to escape from the immune system's supervision.
The cancer cell directly turns off the T cell. And so it turns off its killing, it turns off its expansion into higher numbers, and then it turns off the whole immune system. But it doesn't turn off your immune system's ability to attack, say, the common cold.
After a long period of study, Dr. June's team can now modify the patient's T cells, giving them the ability to identify and kill cancer cells. In a way, it's like operating on genes to cure cancer.
So the trick to make them able to become killer cells for tumor cells is to reprogram the cells so that they now will bind to tumor cells rather than just virally infected cells. So at the heart of our approach is we introduce antibodies that bind to cancer cells, and then those are genetically in your T cells for the rest of the life of those T cells.
Dr. June's team named this approach CAR T-cell therapy, and Emily became the first child to ever receive it. In April 2012, modified T-cells were injected into Emily's body in 3 batches. All the cells were cultured after being extracted from her. After a critical period, the cancer cells in Emily's body were finally brought under control.
Just randomly.
Keep me up here.
You ready? Here we go. Okay, come. We go.
No one can guarantee that cancer cells will never return. But for Emily's family, this is a time to be cherished. It's a result they earned after endless struggles and tears.
She's a stubborn little thing, but I think that's part of what got her through. She just wouldn't give up.
We just would like to say thank you to everyone and know that you're making a huge difference in our lives, and we are thankful every day that we're still parents, because Emily's our only child.
With more and more cancer therapies being developed, an ancient question has once again been asked. Will humans be able to get rid of cancer forever? In our lifetime, the 13 billion cells in our body will divide about 1,000 trillion times. With every division comes the possibility of an error that causes DNA to be damaged. As we grow older, that damaged DNA in our body may pile up, and if one of them happens to carry a proto-oncogene, cancer may occur.
If we were to live long enough, each of us, if we were to live to 90, 100, 110 years, sooner or later, every one of us would develop one or another kind of cancer. So it's not as if cancer is an invention of modern industry, of modern culture, of modern diet. Cancer is part of the biology of complex organisms like ourselves.
So that's cancer. And it can start anywhere. So age is or time, really, not so much age, but time is the villain. The more time we are around, the higher the risk. So as we get older and we get to be my age, the risk of getting cancer is enormous.
Cancer is a disease that is encoded in human life, and it cannot be eliminated as long as there is life. As our understanding of cancer becomes clearer, cancer researchers agree that diagnosis and therapy at an early stage is still by far the best method to defeat it.
Cancer doesn't arise like the Big Bang from nothing and it becomes a huge mass. Instead, cancers arise from small, curable lesions. And so physicians, surgeons, oncologists, pathologists have dedicated decades of their lives to try and find cancers earlier while they're curable.
那经过这么半个世纪下来，我们确实也还是得到一些鼓励。我相信，在逐步的改变癌的观念，改变癌的战略，可能我们人类总有一天会控制癌。
Will it be simple? No. Will it take a long time? Yes. Will we get there? I think we will. It'll be step by step. It will take a lot of work, but we're getting there. And anybody in cancer research today has got a lot better outlook than I had when I started out many years ago.
All patients and medical professionals in the world today share common goals: having a positive attitude, control, and living with cancer while maintaining quality of life. Fighting cancer is the ultimate battle in that we are up against life itself. Perhaps the existence of cancer reveals to us the boundaries of human life. In the battle against it, humans have thus far gained only a minor victory. Despite our many achievements, scientific exploration still has a long way to go before reaching its final destination. The combination of medicine and the latest technology continues to push the boundaries of human imagination. But despite the rapid development of technology, doctors, as always, will continue to play a role in treating patients and protecting human life. Find out more in the next episode of 200 Years of Surgery.